Welcome to Avisena's webinar entitled CMS 2012 Incentive Programs. So for this webinar, we'll be taking a closer look at the incentive programs offered by CMS. First, we will review the electronic prescribing incentive. We'll then transition to the Physician Quality Reporting System, or PQRS incentive, and we'll wrap it up with the electronic health record incentive. I'd like to welcome Wendy Frierson. She is Avisena's Director of Compliance and Education. Welcome, Wendy.
Good afternoon, and thank you for attending today's webinar. This slide illustrates the different incentive programs, timelines, payout, and potential penalties. The incentive program was developed to provide better patient care, as well as an additional incentive to eligible providers. As of today, there's only one program with a penalty associated with it. Today's webinar will provide the audience with an overview of the e-prescribing, the PQRS, formerly known as PQRI, and the electronic health records incentive programs. Now, this slide provides you with your options. Providers, you should consider your options among the three incentive programs that are available. By law, eligible professionals cannot collect incentives from both the e-prescribing and the CMS EHR incentive programs. Providers need to carefully consider which programs to focus on for incentive payments. Even if a provider is submitting for the EHR incentive program, that provider must also submit e-prescribing claims in the first 6 months of 2012 to avoid penalties for 2013 and 2014. And we also have the PQRS. If the provider successfully reports in 2012, the provider will receive an incentive bonus of 0.5% of the allowed charges. This slide provides you with additional information on the different programs and your participation options. For example, a provider may participate in the Medicare EHR incentive program along with the PQRS program. However, the provider is not eligible to participate in the e-prescribing incentive program. Again, everything is based under the Medicare fee schedule. The providers will be paid 75% of their allowed charges for a calendar year. The incentive payments are made annually to the provider, and there are annual limits on the incentive program. So again, providers, you have options. Look at all three programs and decide which programs meet your needs or which program is feasible for you. Now let's discuss the 2012 e-prescribing incentive program. Now we'll discuss the participation in the 2012 e-prescribing program. To participate in the 2012 e-prescribing incentive program, the eligible individual physician may choose to report on their adoption and their use of the qualified e-prescribing system by submitting information on one of the e-prescribing measure G-codes G8553 via Medicare Part B claims, a qualified registry, or a qualified EHR product. So providers, you have three options in order to meet the requirements of the e-prescribing incentive program. So now we'll discuss the e-prescribing bonuses for 2011 through 2014. The eligible provider must submit 25 instances of e-prescribing during the calendar year. You must submit 25 unique Medicare patient visits, report the G-code G8553 using claims, registry, or an EHR product. Providers, you do not have to register for this program. You have 2 reporting periods. You can adopt the 6-month reporting period or the 12-month reporting period. However, you want to at least submit 10 G-codes by June 30th to avoid any penalties for 2013. Now let's look at the denominators and the numerators. As you can see, there are a list of denominators in this slide, and a provider must submit an eligible case using a denominator along with the numerator and generate a prescription and transmit it electronically to successfully transmit an electronic prescription. Again, you have to have a qualified RX system, and you must transmit a prescription electronically. This does not include faxes. Faxes are not considered electronic e-prescribing. So again, you must include a denominator along with the numerator G-code for a successful transmission of an electronic prescription. Let's talk about your submission options. Okay, if you're going to submit via claim, your provider must submit both the denominator CPT code and the numerator G-code on the claims. A successful individual must submit 25 unique denominator eligible cases per a reporting period. For your claims registry, a denominator CPT code and an electronic generated and transmitted prescription, again not fax, is required to report the measures. The provider is also required to submit 25 unique denominator eligible cases per reporting year. Again, providers, it's also recommended that you submit your 12 electronic prescriptions before June 30th. To avoid future penalties. Now we'll discuss our submission options. If you're going to submit via claim, you must submit both the denominator CPT code and the numerator G code on your claim. A successful individual e-prescriber must generate and report an RX event associated with a minimum of 25 unique denominator eligible cases per reporting year. Now for registry, a denominator CPT code and the electronically generated and transmitted prescription, not faxed, is required to report your measures. Also, this provider is required, or this method requires, a minimum of 25 unique denominated eligible cases for a reporting period. Now we'll discuss the e-prescribing hardship exemption. Providers, you may qualify if you're unable to prescribe due to local, state, or federal law or other regulations, if you prescribe fewer than 100 times during a respective 6-month reporting period, if you're practicing in an area with limited high-speed internet access, and providers that are practicing in areas with limited pharmacies with e-prescribing capabilities. Providers, you must request a hardship exemption no later than June 30th of the respective 6-month reporting period to avoid the penalty. Again, June 30th is the deadline to apply for the hardship exemption. Avoid the 2013 payment adjustment. Not all EPs will be able to successfully participate in the incentive program. CMS created several exemption categories for EPs to avoid the payment adjustment. EPs must submit their requests using the CMS Quality Reporting Communication Support page. EP must use the online tool to apply for the exemptions. EPs are permitted to apply for multiple exemptions, but CMS 2 only permits one submission at a time. So providers, you must use the online tool to apply for the hardship exemption. Choosing a qualified RX system. A qualified system must be able to do the following: generate a complete medication list that incorporates data from pharmacies and benefit managers, select medications, transmit prescriptions electronically using the applicable standards, and warn prescribers of possible undesirable or unsafe situation. The system must be able to provide lower cost, information regarding formulary or tiered formulary medications, patient's eligibility and authorizations, and must be able to receive electronic information from the patient's drug plan and send prescriptions electronically. Faxing is not considered a method of e-prescribing. Now, during this session of the webinar, we will discuss the 2012 Physicians Quality Reporting System, also known as PQRS. What is PQRS? PQRS is a voluntary reporting program that began in 2007 and continues to evolve. Expanded measures and reporting options over time to facilitate reporting by a broad array of eligible professionals. CMS collects data from healthcare professionals on quality of care provided to Medicare beneficiaries in various clinic settings. As of today, for 2012, the incentive program is now at 0.5% of the estimated total allowed amount for eligible professionals who meet the reporting requirements. PQRS incentives. An eligible provider who successfully reports on PQRS measures will receive an incentive equal to a percentage of their total estimated Medicare Part B physician's fee schedule allowed charges for covered professional services furnished during the reporting period. Currently, PQRS is voluntary. However, beginning in 2015, failure to successfully report will result in a payment adjustment of your Part B physician's fee schedule amount for covered professional services. The table below summarizes the incentives and the adjustment schedule. Providers, you will be penalized if you do not report in 2013. You will be penalized in 2015, and the penalty is 1.5%. So providers, it is very important to start reporting in 2012 so that in 2013 it's an easy transition. And as you can see, the penalty will increase over time. In 2016, the penalty will be 2%. So providers, it's easier to just report than be penalized. Why should you participate in PQRS? Eligible professionals will have the opportunity to use participation in the PQRS system to improve the care of the patients they serve through evidence-based measures that are based upon clinical guidelines. Participating is a way to prepare for future pay-for-performance programs. A financial incentive is available to reward participating in eligible professionals. A PQRS participant who reports satisfactorily will earn a financial incentive based on a percentage of the Medicare Part B physician's fee schedule total estimated allowed charges for covered services provided during the longest or most advantageous reporting period for which the professional satisfied criteria for at least one of the reporting options. And the question is, what is the allowed amount? The allowed charges are the portion of the submitted charges during the reporting period that is approved for Medicare payment, including deductible and the co-insurance. So your payments will be based on the allowed charges. So this is a reason why you should participate in the PQRS incentive program. Understanding PQRS. We have our numerator, which describes the clinical action required for performance. And we have the denominator plus the numerator, which describes the eligible cases for which a clinical action was performed, the eligible patient population as defined by the denominator specifications. The reporting rate equals the performance met, the performance exclusion, plus the performance not met by eligible patients. Simple steps to submit PQRS. Measure selection begins with a review of the 2012 PQRS measures list to determine which measures may be of interest to your practice and applicable to the eligible professional. At a minimum, the following factors should be considered when selecting the measures groups: the clinical conditions usually treated, the type of care typically provided, preventive, chronic, acute, the settings where the care is usually delivered, in an office, ED, surgical suite, or an outpatient setting, and the quality improvement goals for 2012. After making a selection of the potential measures, we're saying potential measures, review the specification for each measure under consideration and only select those measures that apply to the services most frequently provided to Medicare patients in your practice. And again, once you select your measures, make sure you review each denominator for coding, including diagnoses and the information that's going to be submitted on your claim. So again, you want to make sure you carefully consider the measures that will be used in your practice. How to get started. Gather information from the PQRS webpage. It includes measure groups, measure codes, educational resources, tools, and other additional information. Also, gather information from other sources such as your specialty society, a professional association, the AMA is a great resource, or the State Medical Association. Select the 2012 PQRS individual measures or measures group you intend to report. Determine which reporting method works best for your practice: claims, registry, or EHR. Select a PQRS reporting period, 12 or 6 months. The objective is to report. Now, for the next 3 slides, we're going to have processes for the different reporting methods. This slide indicates the reporting method for claims-based reporting. You will follow the slide if you're going to use the claim-based reporting option. You'll have your 3 measure codes that are applied. You'll report your measure codes for 12 months. You're going to make sure you report on 50% of the applicable Medicare patients based on the Part B physician's fee schedule. Again, you'll follow this grid if you're going to use the claim-based reporting option. For registry-based reporting, if you choose to report based on the registry-based reporting option, you'll follow this process outlined in this slide. Again, if it's individual or measures group, you'll follow the process for successful reporting as a registry-based reporting option. EHR-based reporting. If you choose to report based on the EHR reporting option, you will follow the information outlined on this slide. However, the reporting options for participation in the PQRS Medicare EHR Incentive Pilot Program have been included in this slide to demonstrate meaningful use of the CQM component for the Medicare EHR Incentive Program. However, the basis of this slide is to provide you with how to successfully report using an EHR-based reporting system. The example of a 1500 form. This is an example of a claim-based reporting option, and I would just like to highlight a few areas on this slide. Field 21 indicates the diagnoses. 24D indicates the CPT code, which was a level 99213. We have our quality data codes, which are submitted with a $0 amount. We have our rendering physician in J. We have our pay to NPI number in 33, and lines 2 through 6 are the quality data codes that we're reporting. So again, this is an example. As you can see, the only line item with a charge is the E&M visit level 3. So it is very important that when you are submitting 1500 claims based option, that you review all of the information to make sure you're including all the information that's required for claim-based reporting options for PQRS. This slide is an example of satisfactory reporting. We have Mrs. Jones, age 67, who visits Dr. Thomas today. Mrs. Jones is diagnosed with CAD. We have 3 scenarios based on the E&M level and the diagnosis. For scenario 1, Dr. Thomas prescribed an antiplatelet therapy. Dr. Thomas does not prescribe the oral antiplatelet therapy due to medical reasons for scenario 2, and he indicates that by appending IP. Scenario 3, Dr. Thomas does not prescribe an antiplatelet therapy, and it's identified by modifier AP. Providers, remember to watch your modifiers when reporting your PQRS measure codes. It's very important. So now we will discuss the EHR incentive programs for 2012. This slide outlines the EHR timelines and milestones. As you can see, this process began back in the fall of 2010 and will run into 2016. For 2012, February 29th was a very important day. It was actually the last day for EPs to register into a test to receive an incentive payment for calendar year 2011. What do I need to do to receive my Medicare EHR incentive program? An EP must successfully register for the Medicare EHR incentive program, which opened on April 18th. Meet the meaningful use criteria of using a certified EHR technology, successfully attest using the CMS web-based system that you have met the meaningful use criteria. To attest to the Medicare EHR incentive program, for your first year of participation, you'll need to have met meaningful use for a consecutive 90-day reporting period. You'll need to attest to the Medicare EHR incentive program, and subsequent years, you'll need to have met meaningful use for a full year. We have included the link which will provide you with assistance in obtaining the application. EHR, Medicare Electronic Health Record Incentive Programs for Eligible Professionals. The American Recovery and Reinvestment Act of 2009 provides incentive payment for Medicare eligible professionals who are meaningful users of certified electronic health records technology. The professional is eligible for incentive payments for the meaningful use of a certified EHR technology if all program requirements are met. Hospital-based physicians are not eligible to participate in the EHR incentive program. If the EP provides 90% of its services in a hospital inpatient or emergency room setting, the EP is not eligible to participate in the EHR incentive. Maximum incentive payments for the EHR incentive program. If the providers adopted an EHR software in 2011, they're eligible for the full payment of $44,000. Providers, you still have the opportunity to obtain the full incentive of $44,000 if you adopt an EHR software in 2012. 2013, you're eligible for $39,000, 2014, $24,000. If you're going to adopt an EHR program, now is the time to do it to receive the full incentive payment of $44,000. Payment adjustment in 2015. If an EP does not successfully demonstrate meaningful use of a certified EHR technology by 2015, there will be a payment adjustment. The payment adjustment will be as follows. In 2015, 99% of the Medicare fee schedule covered amount. 2016, 98% of the Medicare fee schedule covered amount. 2017 and each subsequent year, 97% of the Medicare fee schedule covered amount. So providers, let's avoid the adjustment. Successfully demonstrate meaningful use of an EHR certified technology before 2015. In this slide, we have a scenario of how a provider was able to participate in 2 incentive programs, which are also known as a combo. Dr. Smith satisfactorily reported data on the PQRS measures and qualified for the PQRS incentive program. However, Dr. Smith does not meet all the eligibility requirements to participate in the Medicaid EHR incentive program, so he demonstrates meaningful use of a certified EHR technology and choose to receive the EHR incentive payment through Medicare. He cannot receive both the RX incentive payment and the EHR incentive payment through Medicare. So, in his scenario, Dr. Smith's incentive payment for 2011 was $18,500. $500 from the PQRS and $18,000 from the Medicare EHR incentive program. So again, there is a way to receive incentives from 2 of the Medicare incentive programs. Again, weigh out your options. Now we'll discuss the Medicare Advantage incentive programs. Providers who are now affiliated with managed care organizations will now qualify for the incentive program if they are meaningful users of a certified EHR technology. They must furnish on an average at least 20 hours a week of patient care and be employed by the qualifying Medicare Advantage organization, or be employed or be a partner of an entity through contract with the qualifying Medicare Advantage organization and furnish at least 80% of the entity's Medicare patient care services to enrollees of a qualifying Medicare Advantage organization. This slide indicates the managed care incentive table. It provides you with the maximum incentive payment based on the first calendar year in which the Medicare Advantage organization professional participates in the program. So if you participated in 2011, you're entitled to the full incentive. If you participate in 2012, you're still entitled to the full incentive. 2013, $39,000, and 2014, $24,000. So providers, what are you waiting for? Now I will summarize today's presentation. For PQRS providers, you are eligible to receive a 0.5% incentive bonus for successfully reporting for 2012 through 2014. Your reporting options are claims, registry, or EHR. You have individual or group participation. Remember, penalties will begin in 2015 and it will be at 1.5% based on the 2013 reporting period. For e-prescribing, let's avoid the penalties in 2013 and 2014. Your reporting options are the same as PQRS. Please e-prescribe for the first 6 months of the reporting period to avoid the penalties. The hardship exemption must be reported no later than June 30th of the respective 6 months. Remember, this is a web-based application, so please go online to complete the application. Your penalties will be assessed from 2012 through 2014, starting at 1% and increasing to 2%. For EHR, use a certified EHR technology, be a meaningful user, register and attest to the incentive payments. final slide, and it includes a table of the incentive program penalties. It starts with the e-prescribing. Starting in 2012, providers will be assessed with a penalty. For PQRS, starting in 2015, providers will be assessed with a 1.5% penalty based on 2013 reporting period. And for the EHR incentive, it starts in 2015 and it goes up through 2019. These programs are voluntary for a certain time frame. After that, they're involuntary, and you will be penalized if you do not participate in the program. So again, you have your options. Look at your options, weigh them out, adopt a combo, maximize your reimbursement on these incentive programs. Providers, you should take advantage of the additional income while it's being offered to you. Remember, the government never gives anything away, so take advantage of the incentive bonuses. Thank you. We have our first question, and it's how do you begin reporting PQRS? First of all, there's no registration process for PQRS. You'll need to select your measure codes and start reporting those codes immediately. How would a provider go about applying for the EXR hardship exemption? The provider must apply for the exemption via the web portal by June 30th of this year. Again, it's an online application and it must complete it by June 30th in order to qualify for the hardship exemption. Question is, what are the three meaningful use components? The first component is you must use a certified EHR in a meaningful way. Second is you must use a certified EHR technology for electronic exchange. And final, you must use a certified EHR technology to submit your clinical quality measures. Thank you.